So as you said, I'm a physiotherapist, and I'm also head of the School of Physio here in Trinity. I have a passion about seeing patients, so I still love seeing patients. I love working with exercise programs with them. I always have done. I've been working for 30 years, and that's been a particular interest of mine. So I'm going to talk to you today about how we can use exercise and how we prescribe exercise in arthritis. So what is exercise and what is physical activity? Because I think we hear both of those terms, and sometimes I think it can be a little bit confusing as to, are they the same or are they different? So the World Health Organization is the body that looks at things like physical activity and helps us work out how much we need to prescribe. So we describe physical activity as any bodily movement. So that's any movement that you do. So this is really from when you get up in the morning and you start moving, even rolling over in bed, first thing before you even get out of bed, reaching over to turn the alarm clock off, that's physical activity. So it's all the movements that we do during the day. And that can be even when we're semi-sedentary. So I've got one of my kids is a chair rocker. So I don't think he ever sat in a classroom and didn't rock on the back legs of his chair. So he would have been somebody who was moving more than somebody else who might be semi-sedentary. And we know that physical activity is really important. We've got some great research which shows that it has great benefits across lots of different diseases and conditions, such as heart disease, stroke, and diabetes, and then lots of different types of cancers. And it also helps things like high blood pressure, maintaining body weight, and we're going to talk a little bit about that, things like mental health and quality of life and well-being. So throughout our lockdown, we were always allowed to do some physical activity because the government recognised that was important to keep the nation's health. It was part of our public health strategy. And for many people, they did a little bit more, especially in the initial lockdown. And it's a really, really important part of managing arthritis. So as physios, this is what we do. We prescribe exercise. We don't prescribe medication. We treat people with exercise. And I always say to any patients I have that have arthritis is that you have your medication, but actually that's only part of treating your arthritis. The other part of treating your arthritis is your exercise and your physical activity. So just to talk to you about how powerful physical activity is, and this is so topical. So this is from one of the journals that I'm an editor on, the British Journal of Sports Medicine, and this came out 2 days ago, that they looked at the association between physical inactivity, so that's doing no exercise, and your risk of poor outcome from COVID. So they looked at nearly 50,000 patients who got COVID. And the findings were pretty powerful, that they found that if you were inactive, you had a almost twice as likely chance of being admitted to hospital, as being admitted to intensive care, and 2.5 times more chance of actually dying from COVID. And they even controlled for factors. That means they thought about things such as being overweight, and even considering that, obviously that can often go with physical activity, they still concluded that being physically active helped protect you against severe outcome from COVID. So that's really powerful and really important. And I think this paper will have impact in terms of our government public health policies. So obviously a really new disease, 1.5 years old maybe by now, and even there, physical activity is extremely important for our health. So what is the difference between physical activity and exercise? And lots of patients ask me this. So physical activity is any movement that you do from the moment you wake up to the moment you go to sleep, and even when sleeping, people are moving a little bit. And then exercise is a planned, structured, repetitive, intentional movement. So it's a program. You set out to do physical activity, and it's also intended to improve or maintain physical fitness. So it's really all about the planning and intentional that you intend to do this activity. And then cardiovascular exercise is an exercise that challenges the heart and vascular system. So I'll talk to you a little bit more about that in a minute. So I think what's really important to understand in terms of fitness is the different components that contribute to fitness. And when I'm prescribing an exercise program for a patient, I make sure that I include all of these different components of fitness. And we know that if you want to be really fit, that you need to be able to tick every box in each of these components of fitness. So we have our aerobic fitness, our cardiovascular fitness. So this is your things like running and cycling and swimming. So that gets your heart and lungs going. So I think when people think of fitness, this is one of the things they think that's what it's all about. But it's actually more than that. So a fit body is also strong. So it has good muscular fitness. So we talk about muscle strength and endurance. So strength is your ability to lift a weight once, and endurance is your ability to lift it lots of times. And over a general day, you need both strength and endurance. So strength, for example, to get out of a chair, endurance to get up a flight of stairs. Also flexibility. So for joints to be healthy, they need to move through their full range of motion. And I think one of the misconceptions with flexibility is it's about muscle length. It's not really, that contributes to it, but it's really about any joint in your body and how well does it move through its full range. And then balance and coordination. And this is particularly important as you get older. It's associated with things like frailty, your risk of falling. So we like to see that all of these interact together. And often when we prescribe an exercise program, we prescribe a program where you would target a couple of these components at once. So you're not having to do separate exercise programs for each one. And then what we put in there now, and has been a more recent addition, is body composition. So we would make sure that we assess somebody's body composition. And you saw in the excellent talk that came before me how important that is, because that is part of you being healthy. So there are components of fitness. If you want to be fit, you need to address all of these different components. So how much should you be doing? So what we hear from the WHO, the World Health Organization, is at least 150 to 300 minutes of moderate intensity aerobic physical activity a week, or at least 75 to 150 minutes of vigorous intensity aerobic physical activity. And I think those numbers are quite confusing, actually, and I'll talk to you in our next slide about why I think is confusing. And this is one of the things we've been told about patients when we've done research on that. I don't really think we talk about 150 or 300 minutes in a week. I think we tend to talk about days and how much we might do on each day. And I think this is why that 10,000 steps a day has been quite popular, because it's kind of an easy number to remember and it's just per day. In terms of muscle strengthening, about 2 days per week. So 2 or 3 days a week is enough to do muscle strengthening, and that will have a really good effect. And then the other thing is to make sure you're not spending too much time being sedentary. So replacing some sedentary time with physical activity. So that's even light intensity. So moving around a little bit more. And I think that's been really hard during lockdown, where people are actually sitting at their desks all day. So they're literally stagger in their pajama bottoms to a desk, or even some people are working in their bed. And I noticed when I worked at home, I've been in work a lot, that even the walk to the bathroom at home, it can be a couple of steps, and in work is down a corridor or a walk to the coffee shop or something like that. So all those little bits of extra movement during the day are really important. They all add up and they all make a difference to your health. So we actually have done quite a lot of research in physical activity and exercise in populations with arthritis. And one of the things we looked at was what do people understand coming to a rheumatology clinic? What do they understand about the government guidelines? That's 150 minutes or the 75 minutes. And we found that 82% didn't even know there were these guidelines. And then actually 73% weren't meeting the guidelines. And part of it was they didn't really understand how much they should be doing. So they found the public health guidelines confusing. And there were barriers that were common. There were reasons why people weren't exercising. And I'm going to talk to you a little bit about that. And most people weren't meeting the guidelines. So they weren't meeting those numbers that we talked about. So what does it really mean to someone with arthritis, that 150 minutes, that 300 minutes? It means do some aerobic exercise most days, nearly every day for about half an hour. I think that's a really good rule of thumb. So if you say most days, instead of saying 7 days, it means you'll do it about 5 days of the week, which will help you meet that World Health Organization guidelines. So that's something like walking or swimming or cycling, something which gets you breathing harder and gets your heart rate up. Try and do some weight training exercises twice a week. That's really, really important. And the previous talk talked about that one of the things we see with arthritis is something we call cachexia, where we see some muscle wasting in patients. So one of the studies I did with Laura Durkin, some of you may know, and Professor Gay Canan a couple of years ago, we prescribed an exercise program to people coming to our arthritis clinic. And we also looked at their body composition using a special machine that does something called bioimpedance, so it can measure how much muscle and how much fat that you have in your body. And one of the things we saw with arthritis patients, that the weight might be kind of normal or near normal, but their muscle mass was quite low and their fat mass was quite high. So even though on the scales they look quite normal, they had a really reduced muscle mass. So that told us that it was really important to be doing some weight training, resistance training exercises that are also very important for bone health as well. Have a regular stretching routine. So for many people with arthritis, it will focus on specific joints and they'll find those joints difficult to move. So we want to make sure you maintain the movement you do have and that you keep the other joints as healthy as possible. So getting into a regular stretching routine can be really good. And things like the right type of yoga can be really helpful for that because it's a nice prescribed pattern. And this is probably the most important thing I can say to anybody that I prescribe exercise for, is to pick an exercise routine you can stick with, because you'll need to do it for life. For everybody, this is the case, but especially if you have arthritis, once you recognize and accept that it's a part of your treatment, then you need to make sure you're going to keep doing this for life. So what's the evidence here for prescribing exercise? So a little bit of science here. So over the years, we've published lots of papers where we pulled all the evidence together and done something that we call a meta-analysis. So this showed there's lots of evidence that aerobic and resistance training improve fitness, muscle strength, and function. So people feel they can do more. There's the odd study doesn't show any change, but none showed that they exacerbate symptoms. So what's really important in rheumatoid arthritis, we didn't find any studies that showed it made people worse. And we'll talk a little bit about barriers in a minute, but this can be one of the things that people are worried about, that they'll have a flare up. Those of you with osteoarthritis, again, same thing, there's strong evidence, there's significant benefit from exercise interventions, and it helps with pain and helps with function. And what's really important is exercise that combines strength, range of motion, and aerobic capacity. So that's making sure that you target all those components of fitness. And exercise doesn't cause OA. So this is one of the things that often is quoted, and one of the journal I work for, the British Journal of Sports Medicine, we've actually published some really nice studies over the last few years that has shown that being a distance runner doesn't cause OA. One of the things that's quite interesting is things like retired footballers, say they got arthritis in their knees from playing football. Well, sometimes that has been associated with some of the surgeries they got that we don't do anymore. So taking away the cartilage out of the knee, it has increased their chance of getting surgery. So it's important, if you hear those studies, to really understand them well. So some of the studies we've done over the years, we've looked at the influence of exercise on different types of arthritis, and we've published a few papers here, and they all show that exercise is beneficial in arthritis. So people feel better, they have less fatigue, they have better function, and also it's associated with sleep as well. It improves their sleep. So how does it work? So what's the science behind it? And I think you probably started to get a sense now from some of the studies, from the talks that came before. So we know in rheumatoid arthritis, exercise reduces inflammation. It has a direct effect. So I think a lot of patients who see me think that, what does exercise do? It keeps joints moving and keeps you strong. So that's like the scaffolding around the joints. Well, it's actually a lot more than that. It's all these chemical reactions that go on in the body that actually helps reduce inflammation. So it's pretty interesting what can happen there. One of the consequences of RA is reduced muscle mass, that thing we call cachexia. And we know that exercise improves body composition by reducing fat mass. So we know that it's not good to have increased fat, especially around your middle, what we call visceral fat. That really can drive inflammation. And by reducing that, that reduces your general body inflammation. And then it also increases muscle mass, and the higher your muscle mass, that helps as well with you maintaining a healthy weight. We know that exercise suppresses what we call disease-related inflammatory cytokines. So those proteins that drive inflammation, and that's associated with other disorders. So when a single bout of exercise will help reduce inflammation by releasing these chemicals. In OA, exercise appears to lower inflammatory markers in synovial fluid, so that's on your joints. And cartilage really likes exercise, so that's loading cartilage, particularly in your weight-bearing joints, that responds well to exercise. Quite interesting in studies done in things like astronauts, where they did MRI scans on them before they went into space, and then scanned them again after they came back from space. And some of them reported really bad back pain, things like that. And one of the reasons why is because they weren't loading their joints in space. So that's told us a lot about the importance of loading joints for health. And exercise has a positive effect on impairments associated with the disease. So it helps you use what you still have. So just to review the science a little bit again, so it reduces fat mass by releasing proteins which help regulate accumulation of abdominal fat. That's that visceral fat that sits around your organs in the middle. So that lowers your general inflammation. Exercising muscles release proteins which help lower something called TNF-alpha, TNF, which you may have heard. And it helps with regulation and balance of various hormones. So it causes this hormonal cascade. So each bout of exercise has an effect. So there's a fairly scary and complex little diagram, and it shows in these different organs, in the brain and the muscle, the adipose tissue, that we have this effect of a cascade of activity which helps reduce inflammation. So it's really important. So it's much more than just moving the joint or loading the joint or helping with the scaffolding around the joint. It's this cascade of activity that's really important. So the evidence is compelling, obviously. So why doesn't everyone get stuck in? And we've done some research on this over the years. And one of the studies we did, we've done some surveys, but one of the studies we did was qualitative research, where we sat and interviewed people. And I really love that type of research because it reminds me a lot of what I've done with patients. So when patients come and see me, I ask them about the condition and they tell me all about it. And it's to do with their stories. And it's what we call the lived experience of what happens with people and why they get stuck in and why they don't get stuck into exercise. And the evidence has been quite consistent across different studies. It's not just ours, it's not just our patients' experience. So certainly a fear of joint damage and worsening of symptoms is really common in arthritis. And pain, so people feel that they can't exercise because they're uncomfortable, they're in pain, and that one goes with the other. Fatigue and lack of energy is a really common one, that people just don't feel they can even get started, they feel exhausted. And functional limitations. What I mean by that is one of them was raised earlier, and I'll talk to you a little bit about that. Things like feet, you've got really sore feet, it's hard to go walking, or sore knees. So trying to work out what you can do within the limitations of your arthritis can be a real challenge. Time and access to exercise facilities. So some people like to go to a gym, particularly if you want to do things like weights, you often need access to some facilities or weights and time. And so you might be a carer looking after somebody and or you're working long hours and you really just don't have that time to commit to yourself. Motivation. So I think part of it is really believing that exercise is important and it's going to make a difference to your disease, because things take time. And one of the things we look at in any of the exercise studies that are out there, if they haven't committed to doing that exercise program for at least 12 weeks because we think it takes about 12 weeks to really start to see some differences, then we kind of don't take it very seriously. So it's going to take you about 3 months to start to get any real results from an exercise program. So that can be difficult. I think we all like instant gratification, don't we, really? And then mixed messages from healthcare providers. So I think as healthcare providers, it's really easy for us to tell someone not to do anything, and then we've not been responsible for making them worse. So people can be very, very conservative in terms of how or what they tell people to do. So they may say, mind yourself, don't do too much. And while part of that message can be helpful in some ways, it's really not helping somebody get on their exercise journey. So different people telling them different things can be really confusing for patients, and particularly if they don't know how to go about a program or they don't have someone to get them going on a program. So there's lots of great bits of information out there. This is from the American College of Sports Medicine. So a little summary of moving with arthritis, and summarizing that it helps reduce pain, improves fitness, balance, sense of well-being, sleep, and decreases stiffness. There's some lovely stuff on the Arthritis Ireland website. I think Mary Grant, who's a brilliant physio, has done some work on there. So I'd refer you to that. So to get started, well, there's some considerations you need to think about in terms of getting started with exercise. Exercise should be tailored for you, individually tailored, with an emphasis on, first of all, getting you moving more, increasing your physical activity. And we know that it shouldn't make your symptoms worse, but sometimes we need to, there's a little bit of trial and error in terms of prescribing and trying different things to find out what works for you. Remember, this is a program for life that we're trying to create. So it should include some moderate to high intensity aerobic exercise. And I'll talk to you in a minute about why that's important, as well as flexibility exercises. So where you've got joint damage, non-weight bearing activity is probably important. So things like swimming, which is really hard at the moment during lockdown, but there's other non-weight bearing activities. So things like cycling can be important. And as it can be associated with flare-ups, we need to think about modifying your activity intensity through those flare-ups for those of you who have that. So that means you need to plan ahead. You need to think that this could happen and that you have contingency plans for when you get those flare-ups, and how you're going to manage your activity and how you're going to change it so you can keep doing some activity through your flare-ups. So individually tailored exercise programs work the best. So there's thinking about what fits into your lifestyle and what will work for you. And what I always say to my patients is that we don't fix people, people fix themselves, and we coach people. So we're going to coach people through their program and get them going on something that they're going to actually embrace and keep going for life. So setting some goals graduated is really important, particularly if you're from a low baseline. So that means you've not been doing much. It's really important that you start slowly and build it up. Choosing activities that you like is really, really important. Otherwise, you won't stick to it. And balance aspiration against reality. So the worst thing I can see is a patient who wants to do an Ironman or something like that, or they have these huge goals. Think about small goals, setting small goals. And ones that you can actually stick to, that's really important. And measuring your progress really helps. So fitness wearables are cheap and widely available. So most people's phone have even a pedometer on it, so you can measure how far you've gone, or you can even buy one. There's really cheap things on the internet now that you can measure. Even having a diary and crossing off when you've done some exercise can be really helpful. And make sure that your program progresses. So this is where I see people go wrong a little bit sometimes, that they start off with something and they don't change it. They don't make it any more challenging. And so they don't reach the level that they could reach, because they start on the graduated start, but they don't kind of go up the levels of graduation. And as I said before, put some contingency plans in place for when life gets in the way. And it does for the best exercise people in the world. I mean, I've seen Olympic athletes who fall out of their practice sometimes. And I would be very committed to exercise, but I found lockdown really hard. I've lacked a little bit of motivation. So it's okay this happens. And if you plan ahead that that might happen, then you won't be so disappointed with yourself when it does happen, and put some ideas in place for what you're going to do when life gets in the way. And that can be all kinds of things, including things like a flare-up. So in terms of aerobic, which is a cardiovascular exercise, you want to do 30 minutes of quite moderate. So that's breathing quite hard for at least 3 times a week, and even better 5 times a week. So most days. And then some weight bearing activities, such as walking if you can, to preserve bone health. So what we see with many types of arthritis is that we see decreasing bone health. So if you can do that, and there's been some interesting studies, not so many recently, but has shown that doing the more high intensity exercise has not led to joint damage. So at least walking should be possible for most people. Water-based exercise is good. Again, it's really difficult at the moment, particularly in a heated pool. So aquarobics is brilliant. And non-weight bearing exercise, such as cycling, maybe something you can do if you have lower limb disease. So even if you don't want to cycle out on the roads or around a park, you can buy an exercise bike, or even if you have a bike, you can buy what we call a turbo trainer. You just stick the bike on it. And as I said, make sure you try and do some weight bearing exercise. So how do you know if you're exercising at the right intensity? So one of the key things that we always do is do it on prescription in terms of heart rate maximum. So your maximum heart rate is 220 minus your age. So if you're 20 years old, your maximum heart rate would be 200. And then if you're doing aerobic exercise, we want to see you at least 65% of that. So you need to be breathing quite hard, just about able to hold a conversation with somebody, but struggling a little bit to do that. If you go really high, you're into what we call anaerobic, and that's kind of at about 85% and higher, where you can't actually talk at all to somebody next to you. And that's not really sustainable. You'll get very tired from doing that. And athletes do that to train for different activities. So I don't know if any of you saw the brilliant Irish women's rugby team at the weekend. One of them is one of our PhD students. So they would be doing those bouts of high intensity exercise to prepare them for the sprints. But generally, for aerobic exercise, it's half an hour with your heart rate at least 65% of maximum, heart rate maximum. And then strength training. So what do you want to do for that? Really important. So it helps the reduction in inflammation, pain, disease, morning stiffness. So you can use free weights or machines or exercise bands. Exercise large muscle groups is important. It's very difficult to exercise every little muscle group. And hands and feet as well. So when we did our program with Laura Durkin, we gave people lots of hand exercises, and that was really important. And that's simple things like using little clothes pegs and elastics. You don't need fancy equipment for that. For many of you will have problems with your hands, and maintaining the muscle strength in your hands can be very important. Now, this is a little bit of science here, how we measure it. So we do something called a 1RM, which is the heaviest weight you can lift or move. And we then take 60% of that weight. So we do 8 reps to 12 reps of that, repetitions. Put that simply, that means you take a weight and it's something you can lift 8 times and you kind of go, that's about enough. I don't want to do more than that. And you do 2 to 3 reps of that. And that's good enough. That's quite a good prescription. And that will help you improve your strength. And 2 to 3 days a week would be good for that. Gradually increase intensity and manage during the flare. So this can be one of the exercises that can be more challenging during flare. So if you can, that you maintain a little bit of strength training, but talk with your physiotherapist about this if needed. And again, there's some great resources on the ACSM, American College of Sports Medicine page, of all the benefits of resistance exercise. So very, very important for maintaining that muscle mass and helping manage inflammation. So some of the key exercises that I like are things like the lunge here on the left, because that challenges your balance as well. And it also makes you move through your range of motion of your hip, knee and ankle. So this is one of my favorite exercises that I give out. And then on the far right here, the squat. So everybody needs to be able to do the squat. That's you getting up and down from a chair. That's you being able to sit on the toilet. So really important, and that has a huge range of benefits from the lower limb. And also, that's a key exercise I give to people with back pain. If you move well through your hips, then that's going to protect your back. And then we have the one in the middle that you're doing a chest press. So some key important exercises that you can keep in your routine here. And then flexibility exercise is really important to help increase and maintain your joint range of motion. So you have a joint that you have particularly problems with, trying to maintain your range of motion, particularly during disease flare, is really important. Trying to move all of your large joints through full movement every day. So trying to get a routine going there, and things like yoga can be very helpful. And a program you do at least twice a week is really good. So a little bit every day and 2 sessions twice a week. And you can maybe do that after your aerobic exercise. Working with a physio is really good for this, because you can actually think of a specific exercise for certain joints. And then balance and coordination. So trying to incorporate into other exercise routines. So I showed you there the lunge, and we have someone doing yoga here. Really important. Do that on a regular basis, and particularly as you're getting older, that's really important to reduce risk of falls and things like that. So footwear, some practical considerations. So this is the thing I hear a lot, and any of the studies we've done with our patients here in St James's, that really sore feet, which make it difficult to exercise. So there's ways around this. So obviously you can do non-weight bearing exercise, and that's one of the ways to manage it. But I think for a lot of people, trying to manage their sore feet, so thinking about what you can do there. So in terms of practical considerations, always warm up before exercise. And then the best running shoes are the most comfortable. So even in top athletes, there's no running shoe which helps reduce injury. So that's the first thing. So any company that tries to advertise their shoes based on that always ends up in the law courts. So that we don't have any running shoe that reduces injury. So a shoe that's comfortable. So this is one type of shoe that I prescribe, or I advise my patients to get. So this is a brand called Hoka, and these are just, you can get them in the shops like Nike and any of those. They're big, squishy running shoes. There's loads of cushioning in them. I actually run in those shoes because I have back pain, and I find them really comfortable. They feel a bit funny when you first put them on, because you feel like you're on platform shoes, but they're brilliant. They're really ugly, so I don't think the rappers are going to be wearing them, which makes them a bit cheaper. I can't imagine my 21-year-old son wearing them. So that works in our favor. So they're super comfy shoes. And if you have a lot of foot pain, visit a podiatrist or a physio specializing in orthoses. So that's those inserts that go into your shoe. Often by putting your foot in a better position, it can manage your foot loading, and that can be enough to really help you be able to get out and do some walking. And then be sensible about your exercise environment. So think about where you're walking. So there isn't good evidence that walking on grass is better than walking on concrete. And sometimes walking on a path in a park or somewhere like that can be better because it's smoother and with less obstacles. So think about that when you're planning your exercise environment. And then a note about fatigue, because this constantly comes up, and I think it's really difficult, and it's something we even struggle to define in athletes. And certainly some of the studies I've done where we've tested athletes to fatigue, we struggle to then describe what fatigue is. And we've actually changed it when we published the papers to volitional exhaustion, which means they stop when they can't keep going anymore, even though we're measuring all these physiological things like their blood lactate or the heart rate. We've had world champion athletes test in our lab here. We shouldn't be able to keep going considering what the heart is doing, but they do. So fatigue can be really complex. And I think some patients feel a bit guilty about this, that they go, am I imagining this? But it is real. It's very real for people with arthritis. So there's lots of reasons why you have it. So inflammation, disrupted sleep due to pain. So that was our earlier brilliant talk, which I found so interesting. Medication can sometimes be associated with fatigue. Mood, I think if you're in pain, it gets you down. So that can link into fatigue. And then one that we can do something about is deconditioning. So if you're not fit, you're more likely to feel fatigued. So one of the studies that I did with Laura Durkin and Gay Kanan is we prescribed an exercise program for patients coming into the rheumatology department, and we found that exercise had a really positive effect on sleep and fatigue in rheumatoid arthritis. So it improved both of those parameters. They slept better and they felt less fatigued, and of course their quality of life improved and they were fitter. So both mental and physical fatigue is improved with exercise, but the big thing is pace yourself, and a graduated exposure to exercise is best, because I think sometimes it's going to be one of the hardest things to deal with in arthritis. So that's why it's really useful to work with a physiotherapist. So in summary, there's my sport. And I think what's quite interesting about that is I've worked in rowing and international rowing for 30 years. I have come across a number of international athletes who've had inflammatory arthritis. I can think of at least 2 who've had ankylosing spondylitis and competed at the Olympics in rowing. So people can manage it very well, and particularly if they're extreme examples, but exercise can be very beneficial. So there's strong evidence that increasing physical activity and exercise can improve symptoms and overall health in arthritis. It doesn't make arthritis worse. It helps fatigue. And think of exercise as a crucial part of management of your condition, that you embed it in and you commit to it, and you get involved in something which you will stick with, and commit to yourself that there's be a lifelong approach to managing your condition. So thank you very much for your time. It's been a pleasure. I will stop sharing. We're on mute, Ursula.
Thank you again. Thanks, Fiona. That was great. And lots of questions coming in. So one of the first questions I kind of think you've asked, is there a better type of exercise for inflammation? And you've kind of answered that a lot. So I'll put that one along with, can you share tips for overcoming pain as a barrier?
So there isn't, the best exercise is one you like. And so if your barriers are pain, it's something you can do and you can manage with your pain. So pain is a funny one, and we've really changed, and even in the last 5 years, of how we approach pain in exercise. So we used to be very conservative, and we used to say don't exercise with pain, and now we have a slightly different approach, that we respect pain, but that we keep people exercising even if they're in pain, uncomfortable. We do this shared decision making, and we often think about pain on a scale of 0 to 10. And if your pain is 4 and under and isn't getting worse with exercise, then we say, well, let's keep going with the exercise. Let's monitor it. Let's measure things as you're doing it. And that's been a really useful approach. That is, so our advice is not to be so terrified of pain, respect it, work with a professional, but you can exercise with pain, and that is okay. And we find that exercise will often help pain, and you'll see your pain starting to reduce. What we don't like is when your pain is getting worse with exercise, and that's something then to look at your exercise program and maybe modify it.
Okay, so that kind of goes along with another question where they said they were on anti-inflammatories, they were doing exercise, running a lot, but then they had to stop their biologic treatment, their inflammation came back, and then they stopped running because their joints were sore. Should they start running again?
So I would work with a physiotherapist on that, and what might be useful is to get your fitness up a little bit. So maybe with an on-weight bearing exercise, so that might be something like cycling. Swimming difficult at the moment in normal circumstances, and maybe starting with walking and building it back up and monitoring how you respond to that. Yeah. So that can be really useful. And that's why it needs to be individually tailored. So there's not one size fits all for everybody. And like we said, 12 weeks. Don't wait for you to be perfect in a week. Think about gradually increasing your activity over a 12-week period. And by 12 weeks, you should be getting in your stride and in your rhythm then.
Yeah, I think this is a really important question, because I've been asked this loads of times, and you're a better place to answer it, I have to say, Fiona. But a lot of patients are really concerned that if their joints are sore, if they do any form of exercise, they're going to make their inflammation and their joints worse. And that's why they don't do the exercise in the first place. So it's one of these vicious circles. So could you maybe kind of advise them on that?
Well, all the evidence tells us it's the opposite. So with the right type of exercise, with a graduated exposure to it, it will help. We know that. That's the sciencey bits. That's all those proteins and chemicals and your body fat coming down. We know the evidence tells us that it helps. That's really normal to think like that. But I think maybe some people have an experience where they're not quite sure what they're doing, they get involved in exercise and they are sore afterwards. So that hasn't been the right approach. So I think with the right approach, you should see a reduction in pain and you will feel better, and things like fatigue and your sleep will improve. So I'm not surprised. That's what a lot of patients have told us in any of the studies we've done. And that's kind of where we need to get this message out a little bit.
Yeah, absolutely, because I've been asked that so many times, and they are scared. They're nervous that if their joints are sore and they exercise, will they, affect their joints even more and damage their joints even more. And this probably is another one along those lines. So I used to do weightlifting and resistance cardiovascular training. However, my hands, knees and elbows are very painful now. How can I introduce weights back into my routine?
So you're probably doing things like big weights and lifting big weights. So maybe start with smaller handheld weights, and things like bands can be useful. There's some brilliant ideas of weight training. You could do body weight resistance. So some of the things like reformer Pilates, I love that. And they have springs. It has so it's a slidey bed, and they have these springs. So you're pushing against a spring resistance. So there's lots of those studios everywhere. Again, it's a little bit difficult at the moment, but resistance exercise doesn't have to be those big dumbbell weights. It's against bands and springs and elastics and all kinds of things. So it's, again, just trying to see an exercise professional who can get you going on that. And what's brilliant about someone who's done it already before, we call them exercise literates. So you kind of know what you're doing, you know your own body a little bit. So that really helps. So you probably see that you could improve quite quickly with that.
I mean, the next question is kind of similar to that, and I presume this is, depends on the patient. They're asking, what sort of weight training would you recommend and how long per session? I presume that's, patient dependent.
Yeah, it's patient dependent. So I think how long per session, you're kind of looking twice a week, about 40 minutes. Once you go through a couple of groups, choose what you like. So some people like doing little dumbbells because they can do it at home. Some people want to do reformer Pilates. There's classes. I mean, these are people who'd be quite well. There's things like called a Les Mills class, which lots of gyms do. So some of these really clever entrepreneurs who are exercise professionals do these programs where you go from one muscle group to another across a class timetable. So I've sent patients to some of those classes when they've been well enough to do that. So it doesn't really matter. Some resistance exercise is better than others. So even a few minutes, a few times a week is going to make a difference.
Okay, so there's 3 questions left here, so we're going to have to answer them really quickly. So first one is just walking okay? And then along with that is, if I walk too far, it makes my joints sore. Okay,
so that is, like you said, too far. So measure your own distance and what you can do, and bring it back, and then do a little bit less and see if you can build that up. And again, think about your feet and things like that. So I would actually not just do that, put a little bit of resistance exercise in as well.
Okay, and I said this is the last one. What is the best exercise to reduce visceral fat without causing neck pain? Sit-ups?
Okay, so I know what's going wrong here. People thinking you have to train the trunk, the abdominals. You don't need to do that. It's general exercise will get your visceral fat down. So that's general activity. So yeah, you don't need to do sit-ups. Don't worry about it.
Sorry, there was one there who said they had a fracture of their third metatarsal of their foot at the moment. Should they exercise or not?
Well, you're probably non-weight bearing. It's going to need some weight on it a little bit to heal fully, but I would make sure you do some non-weight bearing exercise.
Okay, well, there's more questions coming in now, but I think we're going to have to put a stop on it there. But as I said at the beginning, we've logged all the questions so we can put them on the website and get the individual speakers to answer them. But thanks a million, Fiona. Great